Hi everyone, Dr. Moses here. So today I'm talking about urinary tract infections or UTIs. So essentially, it's an abnormal buildup of bacteria in your urine that can cause you to have an infection in your bladder or in your kidneys. When it's in your bladder, we call it cystitis. If it's in the kidneys, we call it pyelonephritis. Um, so UTIs are more common in females than they are in males. The thought is that, there's a buildup and adherence of bacteria around the urethra, which is where the urine comes out from. And when the bacteria sticks around long enough, they end up going up into the urethra and into the bladder, thereby leading to a UTI. And in males, we typically see UTIs in infants 12 months and under. And then there is a higher incidence of UTIs in uncircumcised males compared to circumcised males. And again, it's typically due to a buildup of bacteria underneath the foreskin that's not circumcised. And that bacteria can make their way into the urethra, into the bladder, causing males to have UTIs. So, what are some of the ways UTI presents? Depending on the age, older kids that can express themselves may complain of burning or burning sensation or pain when they're urinating. You may see increased frequency where the child just seems to want to use the bathroom every half hour or so. Another thing we see is in children that are already potty trained, they start peeing on themselves, or kids that were previously trained through the night, now we're wetting the bed. So when you start seeing changes like that, it may be a sign that your child has a UTI. Also, some kids may have belly pain below the belly button, like lower abdominal pain. Could be a presentation of UTI as well. In kids where the infection may have risen into the kidneys, the pyelonephritis, you may see fever, nausea, vomiting, back pain. Also, your kidneys typically are on the flank and the back over here, so some kids may present with back pain as well. So if your child is having any of those symptoms, certainly have them see their provider as soon as possible to make sure they don't have a UTI. In some cases, a fever may be the only presenting symptom of a UTI. So whenever a child has a fever with no other signs or symptoms, I usually would want to check their urine to make sure it's not a UTI that they have. Also, very foul smelling urine or discolored urine or cloudy urine could be a sign that your kid may have a UTI as well. So if your child has any of this, certainly have them see their primary care provider to be evaluated for a possible UTI. So how do we test for a UTI? Bottom line is we need the urine. The urine gets sent to a lab and, it gets tested and we find out if you have an infection or not. When it gets sent to the lab, it tells us the bacteria that causes the UTI and the antibiotics that work to treat it. Now, again, depending on the age of the child, the urine is either obtained from just peeing in a cup, so you wipe and you have the child pee in a cup and the urine gets sent for testing, or in kids that are not potty trained yet, the preferred method is to get a catheterized specimen, which is a catheter that goes through the urethra into the bladder to obtain urine. Some people may put a bag on the child over the child's urethral opening to see if and when they do pee, the pee goes into the bag and then they get the urine that way. But the catheterized specimen is the preferred, more accurate method, but your provider will decide the best way to get the urine from your child. Now, once a determination has been made that your child has a UTI, they'll typically need antibiotics for anywhere from 5 days, 7 days, sometimes 10 days, depending on how severe it is. If your child has fever, vomiting, they're not really feeling well along with this UTI, like if it's a pyelonephritis, typically those kids need to be admitted to the hospital where they're getting IV fluids and antibiotics through the IV as well. So some of the common reasons why we see UTIs. Now, there are a lot of reasons, structural abnormalities, neurological problems. We're not going to get into that, but the common day-to-day reasons that we see involve bubble baths. Kids that take bubble baths, scented soaps, perfumed fragrant soaps, bubble baths with bath salts in it or any of those things increase the chances of your child getting UTI. So try to avoid doing any kind of bubble baths or using any kind of scented soaps. Another reason we see it is constipation. Kids that have constipation, the constipated belly tends to put pressure on the bladder, which makes it difficult for the child to completely empty their bladder, which causes a buildup of bacteria in the bladder, leading to UTI. So fix the constipation, talk to your doctor about things that could be done to help with the constipation, because that can decrease the chances of UTIs as well. Now, wiping, females, you want to make sure you're wiping from front to back, because so you don't want to bring the bacteria from the back to the front to increase the chances of UTI. So make sure whenever you're wiping your children that are still in diapers or pull-ups, always wipe from front to back. Also, make sure you teach your kids not to hold it, meaning if they have the urge to go urinate, make sure they do it as soon as possible, because when kids hold their urine in their bladder for too long, it can cause the bacteria to build up and thereby increase the chances of getting UTI. So make sure your kids are using the bathroom frequently and drinking lots of fluids to kind of flush out the kidneys. Make sure your kids are drinking lots of water. Definitely avoid caffeinated beverages, but make sure they're drinking lots of water, as this can encourage them to pee more, thereby reducing the chances of any bacteria building in their bladder. And if your child is still in a diaper, make sure you change it frequently, especially the soiled diaper, so your child is not sitting in it long enough to cause the buildup of bacteria to possibly ascend through the urethra to cause an infection. Now, if your child has recurrent UTIs or they have a UTI with a high fever, your provider may want to do an ultrasound of their kidneys and bladder to make sure they don't have any structural abnormalities. So that's about it for UTIs. Make sure you talk to your doctor if your child is having any of the symptoms that we discussed earlier. Until next time, stay blessed.